Okay, so let's talk about this real quick. The saddest news I have to tell a patient. So as I said, I'm a bariatric surgeon, director of bariatrics at Lovelace, and a lot of patients, when they come to see me or they're coming to the seminar, like the seminar tonight, they're worried about, is the insurance going to cover it? That's usually their primary concern. And can they afford the surgery? If the insurance covers it, can they afford it? If not, if the insurance doesn't cover it, can they afford it? Even if the insurance covers it, they have copays, and they have to worry about that. But that for me is not the saddest news. The saddest thing that I have to tell patients is you waited too long. I had that happen to me today, and that's what spurred on this topic, that that the patient unfortunately had waited too long. She had too many comorbidities. She was on oxygen, and she had too many other problems wrong with her. And the sad thing is, she was only 44. She was still very, very young, and I just told her that she waited too long. I wish I had seen her 3 years prior. Could have helped her. And understandably, she cried, and understandably, I cried. And it's hard because I'm what they call a medical intuitive. I never knew this until about a year ago. And medical intuitive is where I can kind of sense things. And I've always been able to do this ever since I was a little kid. And during residency, medical school and training and stuff, I never knew that. And I always thought it was kind of weird, and so I started trusting my instinct. I can kind of tell when patients are sick or sicker. So I always tell my patients, they don't need to panic unless I start panicking, and I never panic. And that's why I like to see them in group. When I see them in group, I can just tell by looking at them how they're doing, if they're struggling, if they're sick or not, and whether or not they need to worry or whether or not additional tests need to be run. And sadly today in this lady's case, I could just tell that she was just kind of beyond my skills. That's not to say there's not other surgeons out there that'd be willing to take her on. And I don't think it was so much that I couldn't do the surgery on her. It was just that I felt she was too high a risk. I was afraid she wouldn't make it through the surgery. But even if we got her through the surgery, she was at a point in her psychology and emotional state that I didn't think it was going to work long term. And I just didn't think it was worth taking the risk, and it just breaks my heart. And I have to do this, probably every other month, maybe, where I see a patient that's just waited too long. So the message tonight for you is I don't want people to wait too long. If you have friends or loved ones. Now, you can't make people do anything, but I hope you'll just encourage them to make changes. Maybe they're not ready for weight loss surgery, but you can encourage them to follow me on Facebook or watch this Periscope broadcast every night, or read my book or something. Just start to make changes. And I know you're not responsible. No one's responsible for anybody else. You're only responsible for yourself. So you can't make them do it, but you can only plant the seed and encourage them. And I kind of wished, 3 years ago, 4 years ago, one of her doctors had encouraged her about it. She said no one had ever told it to her that bluntly and this sort of stuff. But the patient today, I felt like her years were limited, and she was only 44. So it just breaks my heart. And the more I do this, the more I know I'm right. I hate to say that, but every time that I go against my natural gut instinct, I've always been burned. I've never liked that. I always go, man, I should have listened, because that patient wasn't ready for surgery. And the downside of that is, when I see someone who's too far gone, it is a very overwhelming feeling. Now, my patients get that when I say, now, people, if you don't know me, you probably think I'm some sort of quack, but for my patients, give me an amen if you've had moments with me where I somehow sensed something for you, or I called you out on something, or I could tell you were fibbing, or I could just tell you weren't quite ready, and that you maybe just needed a little bit more time, or a little bit more hug, or a little bit more working it out. And And for her, so when I see a patient that's too far gone, it is just an unbelievably sad feeling I get. It's just so, it's overwhelming. It's hard to explain. I get really choked up for words, and it's almost like at the end of the consultation, she was like comforting me. She was like, "It's okay, doc, I know," and it's pretty unusual, so I don't like that to happen a lot. So anyway, the message tonight was just encourage, help me spread the word. Don't let people wait. Spread the word. Tell people that there's options out there, that it's safe and that it's possible, and they don't need to live that way. And what they do with that is on them. That's what they do is on them. It's not on you. You did your part, and slowly, I think together over time we can spread this word, change lives, and get people to living again. Okay, so don't wait until it's too late. A lot of people have doubt. A lot of times, people are sitting at home, unsure, they're scared. Maybe this is too risky or whatever. But what you don't want to do is get to a point where you've waited too long, and I can't help you. And that would just be devastating. All right, that's a little bit of my talk. It was a short talk. It was more of me emoting than actually teaching anything. And I hope you got something from watching it. So I'm going to give you a quick Q&A. I got to get ready for my seminar tonight, so it won't be quite as long. Again, if you're new to the show, I'm Dr. Vuong, Director of Bariatrics at Loveless Bariatrics in Albuquerque, New Mexico. I'm a weight loss surgeon. I'm the author of Ultimate Gastric Sleeve Success, which is available on Amazon.com. Good for anybody. I hope you'll check it out, please. I mean, if you do, that's great. If you don't, that's all right, too. Weight Loss Surgery Success is a meditation guide. Thank you for ordering my book. That's awesome. So what questions do we have? I guess the topic didn't really have anything to say, so you can feel free to ask me anything. I love my book. Thank you. High blood pressure and diabetes, BMI 42, too late? Nope, perfect timing. Don't wait any longer. What's the weight requirement for weight loss surgery? Just look up BMI. Usually it's a BMI of 40 or a BMI of 35 with comorbidity like diabetes, high blood pressure, osteoarthritis. Tattoo medic, you're welcome. Okay, I'm sorry. We're always here for you like you are for us. Love you. Oh, thank you, Stella. Stella's awesome. Somebody's going to snatch you up, girl. How do I get in the right mental state for beating self-abuse? That's a long topic. Let me think about that and do a topic for you, just for you, okay, hon? Where can I learn about? Oh, missed it, sorry. Keep freezing, sorry. Wheat, not good for you. Wondering if to get surgery with no medical, just high BMI. That would work too. High BMI is unhealthy, okay? What's the first step to losing weight? Change your mind, get some good information. So my book is a good place to start. Even if you're not deciding to have weight loss surgery, there's a lot of information out there. I recommend my book, but you can use any book. Just start reading on the topic. Get informed. That's the key. Any more new books? Thank you for asking. My new book on lap band revision is coming out hopefully next month. I'm about 60% done with the book after that, which is, I think I'm going to revise this book for a bypass book. I also have another book in the works that's about 30% complete where I'm going to do like your top 100 tips that you have to do to keep the weight off long term after weight loss surgery, something like that. I've been asked to write a relationship book. I don't think I'm single, so you probably don't want to take relationship advice from the single dude. And also a recipe book, but there are a lot of recipes out there. So, do you have a website? I'm working on it right now. You can find me on Facebook mostly, and Amazon for my books. What's the best diet? I desperately need to lose weight. So if you desperately need to do anything, I suggest you quickly change. And we don't diet. We eat a lot of fresh fruits and vegetables. That's really the key. Geez, I wish you were in Canada. I was just there last year in Montreal. I was at a conference, and it's beautiful. And thank you very much. I know Dr. Michelle Gagne, you guys have some great surgeons up in Canada, so don't fret. But definitely get information. It's about the education. Okay? Do you like the HMR diet? I don't know what it is. I don't diet. We eat really fresh fruits and vegetables. It's not a gimmick. It's just what it has to work. Small portions, eat more often. I don't know if I'd eat more often, but definitely small portions is key. Are you Korean? Nope, I'm Vietnamese. Nice try, though. You should talk about reconstructive surgery, post-bariatric surgery. Yeah, that's an interesting topic. There's some people that specialize in that. We had a plastic surgeon come talk to my patients about that once. When is the meditation class? Yeah, I think we're going to do the potluck next Saturday, October 3rd. That's my birthday, Dr. Vuong's birthday celebration with a patient potluck. So hopefully you can come bring something. That'll be from 12:30 to 1:30, and 12:30 to 2, and I will do a quick talk. I think my talk's going to be the main things I've learned about New Mexico patients since I've been there, something like that. Wishing for 1,000,000 hearts, so keep tapping your screen, please, even on the replay. And click on the little white man, invite some followers for me. We're trying to get me 10,000 followers. I'm at 750, so we got some work to do there, but we're about spreading the news and the good energy. What's missing in bariatric surgery is patient education. That's my role in life, so I've got to fill the space with patient education. Okay? Had surgery Tuesday, and I feel awesome. Miami 32. Okay, good luck. Hi, Doc. Smile, Rosemary. I always smile. Okay. How do you feel about lemon water? I love water. Put some fresh lemon in it. It's awesome. You have to super hydrate, though. How many patients have you performed on? I don't know. I've lost count. Thank you for sharing. Hi, hi, Shivani. Yes, obviously, you're from Miami. That's right. You told me that. I hope you're feeling good. Remember to take your medicine so you get comfortable, okay? Sleeve is a great option. Is bariatric surgery safe? It's safer than being obese. And that's the truth. I'm not being smart aleck. So your highest risk to your health are two things. One, smoking. So don't smoke. Two, it's obesity. Those are the two main causes of preventable death in America. So find a good surgeon, get in a good program, okay? How long have you been doing it for? I assume you mean weight loss surgery. I started my lap banding in 2009. Written lots of books. This is, my new book is book number 5. This is book number 3. This is book number 4. What is gastric sleeve? I would just suggest you Google it or order my book. It talks about a lot. There's only one chapter on the sleeve, believe it or not, in this book. Most of it's about the psychology and what you need, how you need to think and how you need to eat to be successful. No alcohol after surgery. I'd be a hypocrite if I said no alcohol. I think my patients can answer that question better than you. Better than me, I'm sorry. Patients can answer that better than I can. All right. So I really have to go. I love these broadcasts. Are you liking these broadcasts? Should I keep doing them? You know, because it takes a lot of my time. You can always watch it on the replay if you're having problems with freezing. And you can still give me hearts on the replay. That'd be awesome. And I can still block you on the replay. If you don't follow me, thank you. Yes. Good. Don't stop. I'm awesome. Thanks, Jackie. If you follow me on Facebook, I do a 4-minute video recap of this talk. And I'll post that on there. And I'm also going to transition all these videos over to our website once I find time to do that. But I'm looking into that also. And I'll have my literature all up there. And it'll all be for free. Right, so we'll do some free stuff for y'all. Just spread the word. You know, if you're having friends or loved ones who's considering bariatric surgery, one, encourage them. You know, don't discourage them. Don't tell them to wait because you know this is the best tool we have against obesity. And number two, number one was encourage them. Number two is tell them to get educated. Oh, that's what I want to say. It's education is the key. Right? Don't depend just on the surgery. If you depend just on the surgery, it's a coin toss on whether or not you're successful. So get as educated as you can, and that means, you know, for right now, it's my books and me, and there's people trying to come into this place, but really help me. I love sharing your broadcast with my friends. Always awesome. Thank you so much. How long should one wait to travel after bariatric surgery? Please follow the guidelines by your surgeon. I kind of have to just say that. I apologize. But for my patients, it's I tell them the same smart aleck answer, which is stay as close to me for as long as possible. Thoughts on lipo, not good for weight loss. I really have to run. I love these questions. Can I see you again tomorrow night? Oh, wait. Tomorrow night today's Thursday. Tomorrow's Friday. Oh, yes, I am going to be on a plane trip, so I'll be in the airport. I might try to broadcast while I'm in the airport, or the Wi-Fi will let me. I don't know. It might freeze. I'm going to Miami to train, I think, 4 or 5 surgeons on my technique for the sleeve, so I'll probably broadcast that too also. I don't know the time that I'll be broadcasting. You'll just have to tune in or watch it on the replay because I will be traveling, and I apologize about that, but that's just the way it is. And then same thing for Saturday probably. So I'll try to get back on a regular schedule on Sunday, Monday. My Wee Belly, Reddit. So that's it. All right. I'm glad you guys like the broadcast. The Periscopes, keep sharing them. So in summary, the saddest news I have to give patients is that they waited too long. They're beyond my help. They're too high risk for surgery, and I can't do their surgery. I can't help them. And it's heartbreaking. It's heartbreaking because I can feel it. I sense it, and I know their days are limited to a few months or years, and it's just very sad for me. And anyway, thank you for putting up with this broadcast. It was just me emoting. hopefully we'll get something more interesting for you later. All right. Thank you very much. See you later. Bye.